So, believe it or not, today is actually 4 weeks and 2 days since I had my surgery. Prior to the surgery, I had about 6 months before I could go on vacation because it's going to be about a month before we can go back to work. Yes, a full month. Not 2 weeks, not 3 weeks. Don't think you can go back earlier. And to be absolutely honest, that amount of time can even be extended depending on your age, your weight, or your health prior to surgery. It's going to be about a month. I was able to get into the car for the first time about 3 or 4 days ago, comfortably. And I was able to finally start sitting comfortably for about an hour at a time. It took 3 weeks before I could even go to the movies and sit down in a theater and sit for 2 hours. So yes, it's going to take 1 full month. Don't push it. You'll regret it, because any damage that you do to your body during that month, you'll end up just right back in that, in that surgery room, getting cut up again for something else. The best thing to do is to give yourself the most amount of time to recover, so that you don't have to go through this again. So 1 full month. So what I'm going to talk about right now are some of the things that you might want to be thinking about for pre-surgery. Okay. When you get your surgery, depending on the type that you have, I had a microdiscectomy. I was out on that day. Some doctors may choose to keep you overnight, and depending on the severity of your surgery, you may even be in the hospital for a couple of days. But I wanted to give you some advice on what to prepare for, not only prior, day of, and after, but also just kind of what I went through with the surgery. First thing, the surgery went very well. When I first woke up, I made sure that my wife had with her, when she came, when she came with me that day, she had all the pills that I normally take. The doctors aren't going to be readily available to you. They'll get you what you can, but they typically have to wait for scripts. And I was in quite a bit of pain as soon as all the anesthesia wore off, and the doctor was in the middle of another surgery and couldn't see to me for about 2 hours. My sciatic nerve got so inflamed that it felt like labor pains. It was, not that I would know what that feels like, but it was constant pain. It would come in waves, and it was just unbelievable. So be prepared. Doctors will not like to hear me say this, but bring your drugs to the hospital. When I'm saying that, I had my tramadol, and I had a little bit of Vicodin with me. I also used a Valium to calm myself down a little bit on that day afterwards. They typically don't want you doing that, and I totally understand that, but it's one of the things that I had heard, and it saved me a lot of trouble, and it saved a lot of pain that I would have experienced. Okay, when you come home, I'm going to give you some ideas on things that you're going to need to make your life a lot easier. So let's talk about the stuff you want to have purchased and ready for your house, ready for your bed. Okay, ice packs. I had shown you briefly before the thick ice pack that I put around my body with the strap. I'm going to suggest instead that you get this ice pack, which actually is an ice pack. It's the clay pack. And the reason why I suggest this one is if you're getting any kind of back surgery, you don't want to have anything that's bulky, because it's going to hurt. If it's touching that surface that you've got your stitches or whatever sutures you have, it's going to be very painful. This is flat, it stays cool, and it covers an entire area. I was able to sleep with this along my entire vertebra, all the way down to my lower tailbone, and it kept everything nice and cold. And it stays cold for a good 30 minutes, which is really all you need. I would get this thing cold for 30 minutes, my wife would stick it back in the freezer, and as soon as it froze up again, I put it right back on. Ice every day for the first 2 weeks as much as possible. If there's someone, don't stress too much about how many times you're icing, just try to do it as much as possible. The next thing you're going to want to have, remember I told you before that some of those things that you have, that I had when I had my sciatic pain, turned into being great tools for when I slept. This post-orthopedic therapeutic pillow is great, along with this, I don't know what you call this triangle foam pad was awesome. And I set it up just like this, okay? I have one pillow that I put underneath my legs. I also made sure that I had everything close to me. Pills, all the remotes to the TV, including whatever DVDs that and trust me, you're going to be watching a lot of TV, you're going to maybe reading a lot of books, you're going to be on the internet like crazy. you're going to have to stay in bed. Okay? I had my computer close by. I had my iPad, my iPod, and if you come on around, you'll even see that I've got the strip ready to plug in anything that I might need to keep myself entertained, because anything that I can do to keep myself from thinking about my back, I tried to do. Also, last but not least, and while this is a little embarrassing, trust me, it's not something that you're going to be able to do a lot. Getting out of bed on a constant basis is very difficult for the first week. This helped. My wife was able to empty it for me, and I was able to use it at least twice before it needed to be emptied. Even my son was able to help me a little bit on that too. So this is a good way to prepare. Okay. Also, I use this. I didn't really talk about it before to go in between your legs, because you don't want your knees touching after you've had this surgery. When you're sleeping on your sides, you want to make sure that you got nice cushion in between your legs. So what I did is I purchased one of these. It's a cushion that goes in between your legs. It comes with a strap that's about this long, I guess, so that if you're a little bit heavier set, it can fit just about anybody. I put a few knots in it to make it a little bit tighter, because as you're sleeping, it will slip up and down. So I wanted to have it good and tight. Some other things that I used. I want to make sure that you have food on hand, especially if you have a family member that's working. Keep your food. I had a bucket that had ice in it. I had it close by so I could eat and I could drink, and I had water throughout the day. Make sure you have plenty of pillows and help. If it's a neighbor, if it's a parent, anybody, make sure you have someone coming and checking on you at least every 3 or 4 hours, and always have constant access to someone on the phone. That way, if you ever need any help, you can call them, because you might need help. Just getting out of bed, something as simple as getting the covers off of you, is going to be kind of difficult those first couple days. And a schedule. The doctor's going to tell you to start walking immediately. All right, they'll probably tell you the first week, walk around your house. The second week, walk around the yard. Third week, walk around the block. And within the fourth week, you should be walking about a mile a day. I kind of took that a little bit more to the extreme, mostly because I'm a little healthier and younger. So by the end of the first week, I had made my first trip around the block. I shuffled real closely, but the idea is you don't want scar tissue to build up. So what I did is I scheduled it. Plain and simple. On the first 3 days, I got out of bed 3 times. All right, so I'd get morning, noon, and night. First thing in the morning, I'd get up, I'd shuffle around the house just a little bit, and then immediately ice. I'd sit down, I'd watch TV, I'd get on the internet, I'd call family, friends, whatever, and then midday, I'd do the same thing. I kept the same routine for the first week. The second week, I started venturing a little bit more outside, and I always made sure I had somebody with me. Whenever I went on the walks, I made sure I had my phone close hand, so if I wanted to walk a little further and push it, I knew that if I needed to, someone could come and pick me up. For those first 2 weeks, the doctor's going to tell you to stay in a neutral position. The neutral position it's very generic. It's 2 things. You're either standing straight up with the top of your torso sitting perfectly on top of your hips without going forward or back, is a neutral position. It's not sitting down. It's not having your legs up on the recliner. That is a neutral position. The only other way to hold the neutral position easier is to lay down. So that's pretty much the way that I did it. Now I'm going to be teaching you how to traverse this bed landscape.